day the doors of the world opened up for this baby, the day Larry was born, the doors of another world were opening up for a young man named Ronald Lewis, the doors of the world of medicine. Ron had already been graduated from high school and college, but that day Ron really began his studies to become a doctor. That day he entered medical school. As Larry grew, Ron Lewis studied. When Larry was a year old, Ron was attending classes, learning about the healthy body, about the nerves, the blood system, the muscles and bones of the normal human being. And he spent long hours studying complicated medical books. When Larry was 2, Ron was learning, among other things, how to tell one disease from another, how diseases affect the body, and how medicines act on diseases. He and his fellow students began learning how to handle their medical instruments by practicing on each other. A year passed, and Larry was 3. Now Ron was learning about the different kinds of medicine, about performing operations, helping patients with mental illness, caring for children who get sick, and many others. Then Larry was 4, and Ron, with experienced doctors guiding him, was helping real patients for the first time. Of course, he continued studying and going to lectures. And now he was helping in surgery during actual operations. When Larry was 5, Ron was an intern, a doctor no longer in school, but continuing his training by working full-time in a hospital. Now he was really responsible for all kinds of sick people. Soon Larry was 6. That year, Ron began his specialized training to become a pediatrician, a doctor who takes care of children. For that was the special kind of doctor Ron decided he wanted to be. Larry was growing up. He was 7 years old. Though now a doctor, Ron continued his training in a hospital where he treated patients under the watchful eyes of older, highly trained doctors experienced in his specialty, children. When Larry was 8, there came a very special moment for Ron Lewis. His formal training was over, and he was finally ready to open his own practice. It had taken Larry's entire lifetime up to this year for Ron to become a children's doctor. From the day Larry was born, Ron Lewis had been preparing for this moment. Now another year has passed. Larry's 9th birthday party is only a few days away. But Larry isn't feeling very well. Larry's mother knows that when he is so quiet, something must be wrong. Larry's head feels warm, and that usually means he has a fever. When Larry's mother calls their regular doctor, she learns he is on vacation, and he's asked a young doctor new in the neighborhood to care for his patients while he's away. Larry doesn't know it, but he's about to meet Dr. Ron Lewis. Dr. Lewis can see that Larry's throat appears infected. He picks up some of the germs that may be causing the sore throat.
What's that?
It's a throat swab, Larry. I'll send it to the lab and we'll find out what kind of sore throat you have. If the report comes back negative, we'll know that it's not very serious.
Larry does have a fever, 101 degrees. The arrow on the thermometer points to normal. Germs causing sore throat can spread to the ears and nose very quickly. Dr. Lewis makes sure that hasn't happened.
Dr. Lewis, could I ask you something?
Sure, Larry. Go ahead.
Well, my party's on Sunday. I want to know if I can still have it.
Well, that depends, Larry. We'll have to see what the lab test shows and how your fever and soreness respond to the medicine. Give him this 3 times a day, and please call me if his temperature goes up or if his symptoms change. And Larry, I can't promise you anything, but chances are you may be able to have your party.
Oh, hi, Joe. What are you doing here? What's the matter with you? Oh, I'm not sick or anything. I'm just here for my regular checkup. Oh, so long. See ya. Okay, see you in school.
Joey, you can come in now.
An important part of a doctor's work is preventing sickness. Doctors know it is better to prevent an illness or discover it in an early stage than to cure a serious case.
Well, Joey, you've certainly grown in the past year, almost 2 inches. How's your appetite at mealtime?
Dr. Lewis checks to be sure Joey is growing and gaining weight as he should.
Is that a flashlight?
Well, sort of a flashlight, Joey. It's called an ophthalmoscope. It allows me to look through your pupil to the very back of your eyes. Your eyes are fine.
What's that?
You've seen one of these before, Joey. It's called an otoscope. It allows me to look in your ears.
Will it hurt?
Oh, no, Joey. It may tickle a little, and ears are sensitive, and you should never put anything in them. This instrument's specially designed. It allows doctors to see if your ears are okay. Your ears look good, too, Joey. Now, let's take a look at your throat.
That's the part I don't like. I always gag.
It's all right, Joey. Everyone does. It's a reflex. Something your body does without you telling it. Do you know what that reflex is called?
I don't know, but it must have a complicated medical name.
Not this one. It's called a gag reflex. Open wide.
Joey's throat looks healthy, not infected like Larry's.
Good. Now let's see if your heart and lungs are as healthy as the rest of you.
Dr. Lewis is listening to the sounds made when he taps Joey's back. He has learned to recognize the sounds that tell him whether Joey's lungs are empty of fluid and filled with air, as they should be.
Sounds all right here, Joey. Would you like to listen to your heart?
Yeah,
There.
sure.
Just one more thing, Joey. I see it's time for your tetanus diphtheria booster.
That means a shot, doesn't it?
That's right, Joey. But it just sting a tiny bit and it'll all be over in a second.
When you're feeling healthy, it's hard to realize how serious an illness can be. But it's the doctor's job to keep people healthy, as well as to cure them once they're ill. Inoculations can now help prevent many diseases that once were very dangerous.
That wasn't so bad, was it? You're a healthy boy and a brave one, too.
Larry is home in bed following all the doctor's instructions. But despite that,
Do I still have a temperature?
I'm afraid so, honey. It's even gone up a little bit. But maybe the medicine hasn't had a chance to work yet.
Dr. Lewis asked her to report any rise in Larry's fever, so Larry's mother calls his office. Dr. Lewis has already left to spend the afternoon in a hospital clinic where he donates his services. But he'll call his office later that day to get his messages. In an emergency, his nurse would call him at the clinic. At the clinic, the children have many different problems. This child has broken his ankle. This girl has burned her hand. This baby has a bad cough. And this boy has swollen tonsils. 2 afternoons each week, Dr. Lewis works at the hospital clinic.
I'm not sure, Carol. It may be broken. I'm going to send you to X-ray, and then I'd like you to take her to orthopedic clinic and have it examined there. They specialize in bones there, Carol.
One doctor will often send patients to another doctor who specializes in a particular kind of illness. An X-ray is a photograph of the inside of the body. Hard things like bones show up clearly. X-ray technicians are especially trained in this work to help the doctor in deciding what is wrong. The field of medicine is so large that no one doctor can learn all there is to know. So doctors often concentrate on one particular kind of medicine. They become specialists, and it is sometimes said that they learn more and more about less and less. This doctor specializes in bone problems. He is called an orthopedist. Many specialists in other fields work right here in the hospital clinic. For instance, a surgeon is a doctor who performs operations on patients who need them. A doctor who specializes in temporarily numbing a patient's nerves or putting him to sleep during an operation so he won't feel pain is called an anesthesiologist. Knowing as much as he can about this is his whole job. Another specialist is the obstetrician. He takes care of women who are going to have babies. He helps keep the mother healthy while the baby is growing inside her, and he helps when the baby is being born. A baby's heartbeat is so faint, he must listen very carefully with a special stethoscope. There are many branches of medicine, and many doctors who specialize in them. Some doctors don't work with patients at all. They have specialized in finding ways to improve medicines and equipment and in trying to discover cures. We call them research doctors. That afternoon, Dr. Lewis calls his office to check with his nurse and get any messages left for him. He learns that Larry's fever was slightly higher at noon. He calls Larry's mother to tell her not to worry and to find out how Larry is doing. Larry's mother has just been checking Larry's temperature. She is happily able to tell the doctor that Larry's fever has now dropped quite a bit. But Dr. Lewis reminds her that Larry should continue staying quiet and taking the medicine because they still have to wait for the results of the lab test to find out how serious the sore throat is. Today, Dr. Lewis has worked in his office and worked in the clinic, but still his work is not over. Sometimes a child cannot be brought to his office, and it is necessary for the doctor to visit him at home. But most doctors prefer to see patients in their offices. There they have more equipment for finding out what's wrong and for treating the patient. And they don't have to waste useful time just getting to the patient's house.
Well, Susan, it looks like you'll be able to get out of bed in a few days. But you won't be able to go outside for a while yet. You know, it's fortunate that we now have a vaccine for measles, and everyone in your family who hasn't had the disease yet should be inoculated. Measles can be quite serious, but now no one needs to get them.
They'll be lucky. It takes so long to get well.
That evening,
Well, Larry, how does your throat feel now?
It feels fine. It hardly hurts at all. What's my temperature?
It's normal.
Oh, boy, call Dr. Lewis and see if I can have my party.
I'm sorry, honey, I can't. He won't know yet till he gets the results of those lab tests.
at the lab, all sorts of tests are made to help the doctor know how well or sick his patient may be. Larry's throat swab was put into some special chemicals. After a time, the lab technician can tell by the color and the way it looks whether certain dangerous germs are causing Larry's sore throat. As soon as she can tell, she sends the information to the doctor.
How's Larry feeling today? That's fine. I have the report from the lab on his throat culture here, and it's normal. So he didn't have a strep infection, which could have been serious. Why don't you continue the present medication for another 48 hours? As for his party, he can go ahead with it. He's not infectious.
Larry, Dr. Lewis says you can have your party.
Oh, boy! Yay!
That night, Larry's dreams are wonderful. That night, as Larry dreams, Dr. Lewis, too, is fast asleep.
Dr. Lewis speaking. Yes, how high? When did this begin? I'd better have a look at him. I'll be right over.
A doctor often works round the clock. There are emergencies at night as well as during the day. A doctor has to be ready to sacrifice sleep, enjoyment, and time with his family. A doctor is someone with a great deal of schooling and experience, all aimed at curing the sick and keeping healthy people well. He has devoted himself to helping all the people who need him.